And if anyone wants translation devices, they're all available. Thank you very much.
So, good afternoon, everyone. Welcome to the Kurdistan Health Summit in the ancient and beautiful city of Erbil. سيداتي وسادتي، أهلا وسهلا بكم في قمة صحة كردستان في مدينة أربيل العريقة الجميلة. هم لايكتان بخير بان ياناني بارز زو خوشحالين كبو أم سيشنا لقلتانين لهوليدي ديرين وجوان. Seshna كمان بمشوية, and I will switch to English now. I hope everyone in the audience who need interpretation, they get their devices. Great. I will start by reading the objectives for this panel. It will be basically the current state of mental health in Kurdistan region, association between war trauma and mental illnesses, the impact of neglecting mental health in Iraq and Kurdistan, and we will be also discussing and touching base on if mental health is a priority, an area of interest for the Ministry of Health in Iraq and Kurdistan, the roles of international and the role of international organizations, and luckily we have one represent here, Ms. Sherry, and the next steps to provide mental health support. We will start the session by Dr. Muhammad giving us a brief presentation, please.
Okay, thank you much. I prefer to speak in English, as Dr. mentioned. I'm Dr. Muhammad Qadir now. I'm a psychiatrist and I'm a psychology student. I still got more 3 months to finish in London Metropolitan University. So I will start by, it's a very brief touch on mental health because I believe we cannot cover most of the topics that were intended to talk about. It's very specific, so I'm just reminding some kind of definitions before switching to the mental health. So the definition of mental health, sorry if I have a pointer. Okay, just change it, please. The WHO defines mental health as a state of well-being in which an individual realizes his or her own abilities and can cope with normal stresses of life. This is like normal stresses of life. So it's okay sometimes to feel depressed, to feel angry, to feel happy, to feel anxious, but it has to be within a normal range. I don't want to prolong it with this kind of technical things. At what point in time, 1 in 4 people will probably suffer from the mental health. This is by the WHO, World Health Organization. Next, please. Very briefly, the causes of the mental health. We know we have biological causes, that probably some kind of organic causes, some kind of imbalanced hormones. We have psychological causes, thoughts and behaviors and emotions. And the most importantly, which today we'll be talking about, is the environmental causes, like major conflicts, crisis in life, and major psychological traumas that probably we will talk about today in details. Next, please. War trauma. Nearly 60% of internally displaced persons suffer from post-traumatic stress disorder, anxiety or depression. Only these 3 mental health problems consist of 60% of the internally displaced persons. According to another study done in 2004, the higher rates of symptoms associated with higher numbers of trauma experience. For example, if this person has lost more people in the family, more beloved ones, and suffer from economical crisis and suffer from instability, there are higher chance that this individual may suffer from more for example, depression and anxiety and association and other mental illness also increases the severity. Next, please. According to the EPIC report, before ISIS, 33% of children in Mosul had moderate to severe mental illnesses. And today, after the ISIS crisis, after the COVID, we are probably sure that this number, if not tripled, at least doubled. This is only for children. And 33 moderate to severe, regardless of the mild cases. Next, please. Mental health in Iraq. Iraq, like many other countries, spends on average only 2% of its health budget for the mental health. All of the health budget, only 2%. This is according to the WHO report in 2020. Globally, 9 mental health workers are there for 100 people. In Iraq, there's only 2 mental health workers for 100,000 people. And surprisingly, you will not see the below paragraph, 1/3 of these mental health workers are non-professional mental health workers. That increases the burden that we are facing, like we have a severe shortage from the psychologists and psychosocial counselors and psychiatrists. Do not underestimate mental health, because depression is the leading cause of the disability worldwide, according to the Anxiety and Depression Association of America. The members of the LGBTQ probably you will never have ever hear about this kind of mental health of this group, regardless of the cultural differences. We're talking only about the mental health. They are 3 times more likely to experience mental health condition. More than 1 in 4 adults living with mental health will struggle with a substance abuse, probably nicotine or alcohol. And 3 or 4 mental illnesses start before the age of 24. So, which means like the most active generation in the community, in the society, are the most they are more risky to suffer from the mental health. So lastly, there is no health without mental health. Thank you very much.
Thank you very much, Dr. Muhammad. Yeah, I think we have our mics on. Let me start by asking Dr. Rezan, who is the director of mental health in the Ministry of Health in Kurdistan. Thank you. If you can, please, can you give us a brief, and you have 5 to 8 minutes approximately, to give us a brief understanding for us, for the audience, and for our online viewers also. What is the current mental health situation in Kurdistan? And if you have any idea about the rest of Iraq, I would love to hear that as well, please.
Yeah, I have an idea about the rest of Iraq because I'm with them in the group, and I am aware about their activities. And usually when we do programs and projects, we are doing it we are not doing it separately, and we are now about to have a strategy for mental health with the federal government of Iraq, and we are working on it, and hopefully we will get it in the end of 2021, because when you have a strategy, you know where you are and you know what to do, because the strategy will be for more than 5 years, so we will be able to update us and know where is the defect. But it's sad to know that in Iraq, usually we do surveys and then we understand where is the mental health and these things. In 2011, a survey was done and Kurdistan was included. According to the results of the survey, it showed that only 6% of Iraqi people get services when they need any mental, for example, services, which is very sad. You know, 6% is nothing. So since then, we worked to improve our condition in whole Iraq and Kurdistan included, of course. We adopt a mental health gap program, which was really helpful. With the help of WHO, they helped us in training people and having TOTs and also guidelines. And now I'm happy to say that
all the PHCs inside Kurdistan that they have primary healthcare services in it, they are well trained about mental health gap. And in the units in each PHC, they can provide the services, which was really a relief because there was overburden over the one hospital that we have it in each governorate. So this really helped us. And also there was a lot of organizations, actually they were 25 organizations, UN and NGOs that in those, for example, since 2014 when the ISIS came, they helped us how to improve our condition, and also they worked in the camps, and even they trained our staffs about how to give mental services and how to do psychological services. So we are now in good shape comparing to 2011, but again, I'm not happy about our condition because there is a lot of work should be done. One of the things that we are, until now, we are not doing it, it's Mental Health Act that it was approved 2014, and until now, there is no law of mental health in Kurdistan and in whole Iraq too.
Thank you very much. May I also ask you, is there any plans, for me, for the audience and all viewers, is there any plans of Ministry of Health in Kurdistan and Iraq to have a strategic planning for the upcoming years? And I'm thinking mostly about the education, to have and produce and equip our students who are happily choosing psychology in whatever field they want. Is there any that kind of planning so we can meet the need of the society?
Yes, in one of the pillars in the strategy of mental health, it's mentioned that we have to work on our curriculum and we have to improve psychology and psychiatry, and also we have to remove the stigma. The stigma, it isn't for people that they are suffering from mental illness. The stigma is for the psychiatrists and for the psychologists too, which is pity, you know. Until now, our community, even our doctors, you know, they don't accept the idea of being to be a psychiatrist or to be a psychologist, as if there is something wrong with you. That's why you are choosing it. And when we are making fun with our colleagues, we are saying, well, you have criteria, that's why you choose psychiatry. You know, they are just letting us to say these things. So it's very, very important to put it in our programs and in our plans, how to educate the community to accept that, you know, somebody, if they are suffering from any mental disorder, to be brave and go to and say it, you know, to your family, to your doctor, to the psychologist. And also we are in a great need of psychologists, not only psychiatrists, because, you know, what's happening in Iraq, the psychiatrists, they are leading everything, and they are just busy with writing prescriptions for their patients. They will never tell them that there is psychotherapy. Well, you know, I heard you, and now I'm giving you maybe, I'm prescribing you a drug, but you have to go to the psychologist because it's not my work. They are doing both things, and they know nothing about psychotherapy. You know that.
Yes.
I'm confessing. Yeah.
Yeah. Just to add to what Dr. Rezan mentioned about the stigma about mental health, in 2010, IMC and Ministry of Health of Iraq, they did a survey, and I will just briefly touch base on some of the very important points about the stigma in Kurdistan and the rest of Iraq. So nearly 60% agreed that the statement mental health illnesses is caused by a brain disease. Nearly 65% declared that psychological problems are born of a personal weakness, meaning if you are a weak person, you will most likely develop a mental health issue. 80% in that survey affirmed that people with mental health problems are largely to blame their condition. So if you have any mental health issues, you have to blame yourself for that. Just to add to what you just mentioned. Thank you, Dr. Rezan. I will come back to you with the question of the audience at the end of the session. Ms. Cherry, I would love to, as the only representative of an NGO, and I know for sure that you have been dealing with some of the heaviest issues in Kurdistan region. Just to mention one, the ISIS, those women and children who have been in ISIS captivity. What can, as NGOs, what can we do collectively as international organizations to fill the gap between the need that is needed in the community and the services that are provided?
Thank you. And thank you, Dr. Rezan. Is my mic working?
Can we have Ms. Cherry's mic working, please?
Hello? Okay, here we are. Thank you. Well, of course, I'm with an NGO, so I think NGOs have a tremendous role to play, no surprise. I think that Kurdistan has faced the latest battle with ISIS, but it has gone through generations of violence and war, displacement, the Iran-Iraq war, the Anfal campaign of genocide. Yazidis have faced many, many genocides. We've had ISIS is just the latest. And when we look at the needs of the population, KRG has really focused on basic needs. We have 1.2 million displaced people. They need shelter, they need protection, they need food, they need electricity. And I would say that those that are displaced have a very challenging time addressing their mental health needs, and they face severe trauma. But when you look at the broader population, many have faced trauma. Many have been displaced. Many have lost loved ones, have very traumatic grief and loss. And so the mental health needs are high. And the infrastructure to support addressing those needs is quite low. And there have been important steps taken in the last decade, and largely with donor resources, external resources, to address the needs of the displaced. But what about the local population? And so I think the NGOs can play a tremendous role, and I'll tell you what we're doing. SEED is an organization that addresses mental health needs in 3 ways. First, we provide comprehensive mental health and psychosocial support services, so very long-term services, individual services, family and community. So we work at an individual level to address coping and functioning, to address mental health disorders, and to also increase resilience. And we do that in all of our service delivery interventions. But I think it's really important at the same time to help support the KRG, to strengthen its systems, to strengthen its standards and its accountability to the population, so that all vulnerable people can access much needed mental health services. And so I'll just show you one product that we worked on called the Mental Health and Psychosocial Support Services Standard of Care Model. It's been adopted in the governorates of Duhok and Slaymanny, still working on Erbil. But this establishes a standard of care, which is really important to providing services to vulnerable people. And this can be applied by government, it can be applied by NGOs, and NGOs have voluntarily committed to applying this. So we need to build standards and a structure that provides equitable and comprehensive services. And then finally, we need to build the capacity of service providers. Whether they work in government, whether they work in hospitals, whether they're doctors or psychologists or even social workers, we need to focus on building the skills of all service providers to meet the needs of the population. And we do that through our training programs, which takes people that are already working. We work with MOLSA, we work with the shelter staff, we work with ministry staff in MOLSA, Ministry of Interior, DCVAL, DOH, MOH, to address the needs of building skills to identify mental health needs and treat those needs. And then we're working with the university system because the qualifications of those working in these fields really needs to be strengthened.
Exactly. My question to you, Ms. Sherry, is that do you have in your plans a Seed Foundation to have similar education as the one they have in University of the Hague with the German, I forgot the name. They have the study of clinical psychology specialized for trauma.
Yeah.
Is there any plans? I would love to hear that.
Yes, well, as you know, we worked for 2 years with the University of Koya. Koya University has one of now 3 or 2 clinical psychology programs. And I think that's an undergrad program. The De Hoek program is a master's program. It's incredibly important. We have almost all of our psychologists at Seed have either graduated from that program or are currently enrolled in that program. So we fully support that master's program. But setting up a master's program is challenging, right?
It is.
So we're working now with Salahuddin University. They have a very large social work program. And so when we look at specialized needs and community-based mechanisms, social workers have a huge role to play in promoting well-being and mental health. And so we're working with Salahuddin University right now to review their curriculum, to strengthen their curriculum so that social workers can identify mental health needs and focus on gender equality, which is also a huge driving challenge in Kurdistan that leads to mental health, it leads challenges. Gender-based violence is high. And so all mental health workers really need to know more about gender-based violence and its impact on the individual and the family and the community, because it's 50% of all women face domestic violence in their home. So we know that we're going to have an unstable family and an unstable community if we don't address that.
Indeed. Let me add what Ms. Sherry very modestly talked about, the program at Koya University. At that time, I was the director for that center. Basically, what Seed did, we have many workers who are dealing with, having mental health issues, and even non-specialized services. But they are not social workers, they are not psychologists. But yet they are very eager and very committed to help those people in need. So what Seed did was to really cover all Kurdistan, and whoever was given those services could apply for the program. One thing that was very unique for that program was Seed didn't let the participants to be alone with their questions after the theoretical part. So they had the great part of the program to be supervised and enhance your knowledge and your skills as a service giver. I hope you continue with your great work.
Thank you. So I think that coaching element of the program allows our participants to take what they learn in class and apply it on the job with support from our coaches. And we found that useful for government workers, for the police that we train, for shelter staff, for NGO workers, that having a partner, having mentorship and ongoing guidance in the application of this knowledge and skills to be able to apply it at work is really useful. And so, thank you for sharing that.
Thank you. Dr. Gerard, I came across many of your incredible research, and we have something in common, which is PTSD. Yes. So please, you have 8-10 minutes to introduce your research, or
Thank you.
You're welcome.
I am interested to be in this panel, especially I'm an epidemiologist. Dr. Mohammed introduced for us the definition of mental health, which is established in 2004. And you notice that it is not an illness. It is not the illness. He said some character of this mental health. And mental health, sometimes what is in Western countries is not applicable here. He talked about LGBT, which is not allowed her to talk about them because of our society, our community, and that is it. What was interested in Iraq, there are many surveys for youth. In 2006, 2009, then mental health surveys, and in 2006 also, and the family survey. All of these shows us some items which we are missing it. That is mean the violence and the types, aggression. In the school, there is bullying in the female and the male. Then the substance use disorder in Iraq. And after ISIS, we face amphetamines and methamphetamines. And now it is widespread in the south and in the middle. I don't know what's going on in Kurdistan. I have to live 2 days more, and I will find that, because I was to pick it quickly. It is in all our cafes. So what I did in my research and published, you notice that.
May ask you to have the microphone, because I don't want the viewers and the audience miss your very informative speech.
Thank you. The PTSD. We found the PTSD in our schools, and it was a very high rate. The psychiatrist object of that, because Iraqi mental health survey says 1.6, and in our literature 22.6. Now I think it goes to 80%. This accumulated trauma lead to complex PTSD, and complex PTSD is borderline personal disorder, and the psychiatrist interested in the item of psychiatry because it is personal disorder, and he will treat it with pills only. And the suicide now appeared to one. The main manifestation of PTSD, or the complex one, is emotional instability, and you can't notice the manifestation in Iraq. I am talking about the south and the middle. I don't know in Kurdistan. There is increase in the rate of divorce. There is increase
Indeed.
in the rate of domestic violence. This is emotional instability. This is personal borderline disorder. This is a complex PTSD due to the accumulated trauma. The doctor said that the accumulated trauma for the wars, accumulated trauma for those displaced, accumulated trauma for ISIS, accumulated trauma for this Qaeda and this explosive, accumulated trauma with the conflicts and internal conflicts. And in Iraq there are many internal conflicts, even between Kurds and Arabs. These are conflicts. It will put their shadow on the health, on the mental health of people. Really, mental health definition was ordered by Truman, the American president, in 1945. He asked the psychiatrist to find the definition for mental health. And in 1999, they found the definition, and it was modified to WHO, to all of these recent events. So we are delayed from those. In Ministry of Health now, they are planning to integrate these services with the services of primary health care. That's mean that the primary health care physician can deal with these things. Then we have to train psychologists and sociologists to be aware of the determinants, and there are many determinants, how they can build the personality to be not affected in these things. These are what we are looking for. However, can we success or fail in that? It depends on the next generation, because I am too old. The next generation. I think I give you something.
يعطيك العمر كله.
Allah help.
Thank you very much indeed. I would ask the speaker we will soon open the floor for any questions of yours. Till the speakers do that, so please register your name for any questions you have. Till we do that, I just wanted to touch base and come back to the first of the session where Dr. Muhammad talked about that there is basically no health without mental health. And I think in this region, we are badly and desperately in need of understanding, a broader understanding of that, because health, to have a good health and to be able to get health services, actually it's a human right. All of us should have the right to get the right health and mental health services. And also, at the same time, to have a good health is a prerequisite to development. And I would tie it again with what Dr. Jawad mentioned, that, and I quote one of my clients, she called me and asked to get some sessions with me, and I asked her, what can I help you with? She said, no, but I have no mental health issues. I'm not crazy, yet I'm very angry. I'm having some, and she diagnosed herself too, I'm having some panic attacks. I can't deal, and I don't, sorry, I can't be the mother that I want to be. And, sorry, I was thinking all of these are mental health issues, if not illnesses. So we need a broader understanding altogether, the ministries, the NGOs, but also the community who has been suffering since 120 years from war, crisis and conflicts that led to, we are now back in history, unfortunately, because mental health and health, it is a prerequisite to prosperity. People who do not have access to healthcare and stuck in a vicious circle of poverty and poor health, which can also lead to social instability and migration. And we, unfortunately, in Kurdistan, I don't have any data for the rest of Iraq, but we have many, our younger generation who immigrate, which is not the ideal situation for a country like Iraq, to whom really we need to build a more stable, in-depth infrastructure for health and mental health. Thank you very much for my panelists and presenters.